Many people ask me what a naturopath is. A naturopath is someone who looks at you in a very holistic way, looks at you, the overall, the whole person. So so if you come to me with a pain in the knee, I won't just focus on that pain in the knee. I will focus on the whole individual, because that part of your knee is part of you. And what I often get is a lot of people that don't quite understand the difference. Obviously, a naturopath, we deal with things in a very, very holistic way. So we're not medically trained. We don't look at the symptoms. We look at what the root cause is. So, for example, with me, when I qualified in nutrition. I did a 3-year postgraduate degree in naturopathy, and I did a 2-year in stress management. So I qualified, and I used those collectively. Other naturopaths may have qualified in homeopathy as well as naturopathy. So we all use our skills in a very, very in a synergistic way. So that's what naturopaths do. We basically get down to the root cause. And when I'm doing a program with you, one of the things I might focus is, well, 3 things I focus on actually, is your lifestyle. So could there be something in your lifestyle that's causing it? I look at your diet. So we look at, okay, what is it in the diet that could be potentially giving you a little bit of those symptoms, and predispositions. So basically, what have you potentially inherited from mum and dad? So, and really, your health is really pretty much unique to you, because we've all got different mums and dads. We all inherit different things. So potentially, when I do a program for somebody, it's very, very bespoke. It's very unique to you. And in that program, again, as I say, I'll look at your diet. But again, one of the other things I bring into the mix could be functional testing. So, for example, if somebody comes to me with, they're not sleeping very well, they're getting palpitations, this sort of thing, I might suggest when I've done the health assessment, I might suggest, okay, well, I'm going to give them this. I'm going to give them some supplements. I'm also going to give them some techniques to do, stress management techniques. But I might also suggest, okay, just to get really pinpoint what we're going to give you in terms of supplementation, I might say, let's do a test. And it could be the adrenal stress profile that I might do. For somebody else, I might want a bigger, wider picture. So I might do something called an organic access test. So collectively, I use all those skills to really, really get down to the nitty-gritty of what is going on with you. Okay, so I just really wanted to make this video just to give you an idea of what naturopaths do. And I see people who have chronic fatigue syndrome. I've seen people that have lost their hair. I do see children. Most of my clients, I do get some men as well who might come and see me. I've had people from all walks of life, people externally, people in Scotland, people in Australia. I've had quite a few people, and I do these via Skype. Okay, and it's less stressful and it's easier for the person. So, but yeah, I do deal with a variety of things. My speciality is gut health, is stress management, and what is going on with the gut. So I do focus a lot on the gut. And the other thing that I tend to focus on is biofeedback therapy. So I actually studied in America to attain my certification in biofeedback. So, feel free to subscribe to my YouTube channel. I do lots of tips and hints, but that at the end is what a naturopath does. So if you've got any further questions, please leave some comments below. Thanks, and see you soon.